Imagine walking into a hospital with no paperwork, no waiting, and no soul-crushing bill. Now imagine the same in America. Sounds impossible, right? That's because the American healthcare system isn't just broken, it's practically designed to stay that way. The US healthcare system is like a luxury sports car running on flat tires and duct tape. For the richest nation on earth, it's a paradox. Cutting-edge medicine wrapped in bureaucracy, profit motives, and pain. But what if AI didn't just assist? What if it took over and actually fixed the system? Let's talk about how artificial intelligence could crack this code and create a healthier, saner America. If you're into smart solutions that challenge the status quo, hit that subscribe button and turn on notifications. We can't change the system without you. America's healthcare system is a mess of contradictions. On one hand, it's home to medical miracles, robotic surgeries, gene therapies, and cancer treatments that sound like science fiction. On the other, people are rationing insulin, avoiding ER visits for fear of bankruptcy, and drowning in bills for a 5-minute consultation. You've seen the headlines. A mom launches a GoFundMe to pay for her child's leukemia treatment. A man gets billed $42,000 for an ambulance ride. And let's not even talk about the administrative nightmare. The average American doctor spends 1/3 of their time filling out forms instead of treating patients. It's not just patients who are suffering. Nurses are quitting in droves, exhausted from double shifts and burned out from being glorified data entry clerks. Medical debt has become the leading cause of bankruptcy in the US, and more than 30 million Americans remain uninsured. The system is crushing even the people it was supposed to help. Meanwhile, Donald Trump made healthcare a central pillar of his political identity. Repeal and replace Obamacare, he chanted at rallies, promising a system that was beautiful and a fraction of the cost. Congress, meanwhile, gridlocked itself into oblivion. Republicans fought for deregulation and market freedom. Democrats pushed for more government oversight and safety nets. The result? A status quo where big insurance quietly fattens its profits while patients and providers scramble to stay afloat. And let's not forget the human cost hidden in the statistics. Behind every number is a face, a father choosing between rent and chemotherapy, a young woman dying of an undiagnosed heart condition because she couldn't afford an MRI, and millions of kids growing up in families crushed by medical bills. The damage ripples across generations, leaving scars we rarely see on glossy hospital brochures. Here's the brutal truth. No one wants to touch this system because too many powerful people benefit from its dysfunction. Donald Trump tried to bulldoze Obamacare but underestimated the hornet's nest of lobbyists, lawyers, and political landmines. Congress, split between progressives yelling for Medicare for all and conservatives warning about socialism, could barely agree on what to order for lunch. Enter big insurance. With deep pockets and armies of lobbyists, they've made sure real reform gets watered down to slogans. For every new plan Congress cooks up, there's a counter-strategy in some glass skyscraper boardroom to preserve the premium-based model. The industry has woven itself into the fabric of American politics. Campaign contributions, slick ad campaigns about choice and freedom, and fear-mongering about government-run healthcare have all kept Americans wary of big change. There's also the emotional barrier. Americans are deeply skeptical of anything that sounds like socialized medicine, and yet they're also furious at $500 EpiPens. It's a cultural tug-of-war that leaves solutions stuck in neutral. And then there's the data problem. Healthcare in America is a patchwork of incompatible systems. Hospitals don't talk to each other. Insurance companies hoard information. Patients have no control over their medical histories, and doctors are left flying blind when treating new patients. Fixing that? It feels like trying to untangle a million knotted wires, blindfolded, underwater. The complexity isn't just technical, it's emotional. Every attempt at reform turns into a culture war. One side fears government overreach, the other sees corporate greed as public enemy number one. And while they argue, lives are literally on the line. So what happens when we let AI drive the ambulance? Phase 1, 0 to 6 months. Urgent action. AI starts by attacking inefficiency. Think machine learning systems auditing billing codes in real time to slash fraud and overcharges. AI. Chatbots triage patients 24/7. directing them to urgent care, telehealth, or a specialist without a human middleman. Predictive algorithms monitor public health data to anticipate flu surges and supply shortages before they spiral. And here's the kicker. All medical records are integrated into a national AI-powered system. No more faxes. No more fill out this clipboard for the 5th time. Patients control access to their data with a tap on their phones. Doctors can instantly pull up full histories, cutting misdiagnoses in half. Phase 2, 6 to 18 months. The rollout. Now, AI goes deeper. Imagine an AI negotiating directly with pharmaceutical companies to secure fair drug prices on behalf of 330 million Americans. Algorithms optimize hospital staffing and supply chains, slashing wait times and preventing burnout. Personalized medicine powered by AI matches patients with the most effective treatments based on their genetic profiles. Donald Trump, still craving a legacy project, embraces this as Trump Care 2.0, boasting that AI has made American healthcare the best in the world. Congress, sensing voter approval, passes sweeping AI healthcare integration laws. Big Insurance tries to fight back but discovers their own AI analytics recommend pivoting to prevention-focused business models to stay profitable. Phase 3, 2 to 5 years. Stabilization and measurable impact. 5 years in, the US spends 30% less on healthcare while outcomes soar. Chronic diseases plummet as AI coaches help people make healthier choices. ERs aren't flooded because AI virtual clinics catch problems early. And yes, that mom with the leukemia-stricken child never had to post a GoFundMe. Of course, this isn't a utopia. AI isn't magic. There's the risk of data breaches exposing sensitive medical information. Algorithms could inherit the biases of their human creators, reinforcing inequities rather than eliminating them. Big Insurance might even game the AI, twisting it to maximize profits under the guise of efficiency. But here's the difference. AI can self-correct. Transparent oversight committees, real humans with real power, constantly audit the algorithms. Patients own their data, and any AI recommendations require their explicit consent. And if Trump tries to hijack the system to slap his name on every hospital wing, Congress, with some helpful AI analysis of voter sentiment, blocks him before the bronze plaques are ordered. There's also the fear of dehumanization. People don't want to be treated like data points. So AI isn't replacing doctors, it's giving them back time to be human. Instead of staring at screens, they're staring at their patients, listening, diagnosing, and caring. And when the inevitable glitches or controversies arise, AI systems are designed to flag them instantly. No more waiting months for a Senate hearing while the damage spreads. Problems are caught, explained, and fixed, often faster than human bureaucracies ever could manage. So here's the question. Would you trust an AI to redesign America's most broken system? Or would you rather keep the human-driven chaos we've got now? Imagine never fearing a medical bill again. Imagine doctors spending all their time treating you, not typing into clunky systems. Imagine AI as the tireless architect of a healthier, fairer country. That future isn't science fiction. It's a choice, one we can make together. If this vision makes sense to you, hit that like button, subscribe, and turn on notifications. We're building something smarter, together.